Good evening. My name is Nick Hammond, and my co-host here, Luke Kulak, and I are going to be moderating a friendly discussion on the difference between the drugs ticagrelor and prasugrel. Here with Team Ticagrelor, I have Dan Damer representing AstraZeneca, and here I have Mei Hang representing Eli Lilly, who has prasugrel.
To give you guys some context, both drugs are commonly implemented in the case of acute coronary syndromes, specifically ST and non-ST elevated myocardial infarctions, where the procedure PCI, or percutaneous coronary intervention, is implemented. These drugs operate by preventing platelet aggregation associated with the physical stents that are placed into a patient's coronary arteries.
I've been told clinicians who monitor the use of these drugs in their patients must assess for abnormal bleeding, as this is a relatively common side effect of these medications.
Some fantastic insight there, Nick. Now, before we dive into this discussion, we want to address the elephant in the room. Dan, we hear you have some pretty strong feelings regarding the use of clopidogrel.
That I do, Luke. So ticagrelor was proven to be superior to clopidogrel basically worldwide, except North America. In North America, it was shown to be roughly equivalent in its efficacy, and it's still unclear as to why that is. But what do you have to say about prasugrel, May?
Prasugrel was also determined to be better than clopidogrel with the Triton TIMI 38 trial, and also in the ISAR REACT 5 trial, prasugrel is also proven to be better than ticagrelor.
Ooh, man.
Okay,
Alright.
let's settle down for a minute. We can't be jumping to conclusions here.
Yeah, let's back up a minute. Dan and May, how about you guys give us some background information on your drugs, and then we can delve into those trials if you guys would prefer.
All right, yeah. So ticagrelor is a non-thionopyridine that is chemical derivative of nucleosides, and it's characterized by reversible inhibition of P2Y12 ADP receptors, and it prevents signal transduction and platelet activation and aggregation.
Prasugrel is a thionopyridine that work by irreversibly bind to P2Y12 and prevent it from binding to ADP. It is indicated for ACS and PCI in addition to or alternative to aspirin.
All right, well, let's just change the subject a little bit. Dan, what does this dosing for your drug look like?
That's a great question, Luke. Ticagrelor is definitely going to win this one. So ticagrelor has a loading dose of 180 milligrams for PCI, and then it's 90 milligrams twice daily after that. It also has to be taken with 81 milligrams of aspirin every day. Since it's a mild CYP3A4 inhibitor, it's not recommended that it's used with CYP3A4 substrates, which have a narrow therapeutic index.
How about you, May?
Well, the loading dose for prasugrel prior to PCI is 16 milligram and then 10 milligram PO daily, or 5 milligram if the patient is less than 60 kilograms. It is a prodrug that is metabolized by CYP2C9 and CYP2C19.
How about them trials, guys? Dan, would you please start us off?
Sure thing. So in 2009, a double-blind randomized trial compared ticagrelor and clopidogrel for prevention of CV.
You do know we're comparing ticagrelor to prasugrel, right? Whatever. Lily, can you please give us some relevant information?
Sure. This year, the ISAR REACT 5 trial compared the use of ticagrelor and prasugrel in patients with ACS. The outcomes show that the incidence of death, MI, and stroke was significantly lower among those who took prasugrel than those who took ticagrelor. Additionally, the bleed risk associated with prasugrel was found to be less than ticagrelor.
Seems like both sides have some good data backing their products. Let's go on the ground to our patient testimonial correspondent, Deanna.
Are you kidding me? I talk to way too many people on a daily
hold on.
basis.
I'm sure you do, buddy. Since the tension here is palpable, we're going to move on to the next segment of our show, where our guests face off head-to-head in a little trivia game.
So, the game is simple. We'll ask you a question, and the first person to hit their buzzer and answer correctly gets a point. We don't really have buzzers anymore, budget cuts, pay cuts. Anyway, if you answer incorrectly, the other person can steal your points by answering for you.
Really? No buzzers? What's your salary here?
Whatever. Let's get started. Question number 1. What are some common adverse effects of your drugs?
Torsades de Pointes.
Mr. Damer, what you've just said is one of the most insanely idiotic things I have ever heard. At no point in your response did you even come close to anything that resembled a rational thought. I award you no points, and may God have mercy on your soul.
So, May, do you know the common adverse effects of your drug?
Yes, I do, Luke. Some common side effects of Prasugrel include hypertension, hyperlipidemia, and headache, and some serious ones include bradyarrhythmias, AFib, major bleeding, angioedema. And the correct side effects for ticagrelor are bleeding, increased serum creatinine, and shortness of breath. The major ones include bradyarrhythmias, major bleeding, and angioedema.
There's no way that's right.
Well, Dan, that's in fact entirely correct. And for answering both questions about both drugs, May, you're awarded 2 points.
All right, next question. What are some quality counseling points that clinicians should share with new patients taking your drugs?
Well, for Prasugrel, the patient should inform their physician that they're taking this medication before any surgery, and they should also avoid taking any other medications that increase the risk of bleeding, such as warfarin and ibuprofen. And lastly, it should not be discontinued suddenly because there's an increased risk of stent thrombosis and MI.
That's correct. May, you get another point. Dan, if you can tell us about yours, we'll give you a point so you're not too far behind.
Well, I think it's like reporting signs and symptoms of bruising, bleeding, and unexpected shortness of breath. I think you also shouldn't suddenly discontinue it, and it must be taken with 81 milligrams of aspirin, not to exceed 100 milligrams per day.
Honestly, this game is so useless. Prasugrel is the only P2Y12 inhibitor on the UPMC health plan preferred formula. You and your ticagrelor is trash. You shouldn't even be here.
Are you kidding me? I'm coming over there.
Okay, thanks for tuning in, everybody. We'll see you next time.